You began your career focused on direct patient care, but now you're looking at what life might be like away from the traditional use of your education. In this episode of RDH Coast to Coast, Tina and Kim share some insights into their journey away from direct patient care and some advice for those who might want to do the same. So friends, grab your headphones, take a deep breath, and a little glimpse into the life outside of the patient's mouth. Kim, we are back getting to be together again. Oh, and we're into fall. I think we are, when this airs, we
Don't say
will
that.
officially be in fall.
I don't want to hear those words. So many people love fall and they want to break out the sweaters. No, I want summer. I don't want pumpkin. I don't want pumpkin spice. I want bathing suits and humidity. That's what I want.
I was just going to ask you, are you a pumpkin spice girl?
I mean, I love pumpkin and all of it, but for us in the Northeast, fall is just a reminder that winter is on its way.
Winter is coming. Yeah. As we're recording this, it's still summertime. And I was walking the neighborhood and saw some leaves changing color. And I was like, wow, it's starting to happen. It's starting to happen. So
I'm not ready. I am
not ready. Yeah. And, speaking of kind of changes, I guess we could say, when we go into dental hygiene, we normally start off with a very clinical focused mindset as far as our profession. And then somewhere along the ways for many people, there's this change that comes about where we think maybe I want to go stay within the dental world, but maybe go in a more non-clinical aspect of that. And Kim, I know that you've walked that journey a little bit. So do you mind sharing with us and sharing with me your process of going clinical to non-clinical and what did that look like for you?
Of course. And I think we can all agree that sometimes we just, as much as we all love patient care and caring for our patients in the best way that we can, it can get mundane, or you don't want to do it for 8 hours a day, 4 to 5 days a week. So I knew myself personally when I was in hygiene school that I wanted to come back and teach. I loved what my instructors brought for me and how much they impacted my time in school, that I knew I wanted to be able to give back in the same way. So every year after I graduated, I wrote my whole end of school paper about how I wanted to come back and teach. I came back and visited and I hung out. I got my teeth cleaned every year in our clinic. So when a job became available, I applied, and maybe it did help that they were seeing my face all the time and they knew how much I was interested in pursuing teaching. So I did get hired on a clinical instructor outside of school, and teaching has been very rewarding for me. And I do very much enjoy it. And speaking of teaching, you also work in academia as well.
Yes. So my role, my transition from being 100% clinical to non-clinical started off as being an educator for sure. But, there are so many realms of non-clinical work. And I personally have dabbled a little bit in all of them. But, being a product rep, right? Working with different companies all the way, it could be your distributors, the Shine, Patterson, Burkhart, Benko, Darby. I'm sure there's more. I'm trying to remember some of those names, being a rep for them, you're still in dentistry, but a non-clinical aspect, or being a representative of places like Waterpick or Young or Hugh Freedy, those types of specific dental products. And, I'm throwing these names out. These companies don't give us anything, by the way, people. I'm just throwing names out. But, being a rep for them, I worked for Waterpick as a hygienist. So I would go to different dental offices and doing lunch and learns. And it was a lot of fun as an opportunity to use that knowledge of the oral health and oral health disease and understanding the clinical life and the clinical aspects and the time frame that you have as a clinician to be able to combine that together to share with different offices, right?
Yes. And
yeah.
Tina, I want to ask too, with being going in and doing lunch and learns, did you meet a lot of great people along the way too? Is that
Oh
a good networking
gosh. Yes, absolutely. I'm like, if you really want to get to know your, especially your local dental community, having that opportunity is golden. And then you kind of go and create some new relationships, and another great way to kind of expand your horizons as far as your own patient care philosophy. You might hear somebody say, oh yeah, well, we like to do X, Y, and Z, or we use this product or that product. And you're like, okay, that makes a lot of sense. And I could see that. So yeah, it definitely, I highly recommend it. Now, there are some drawbacks to being in a role like that, for sure. Like if you are a product rep, there are definitely some drawbacks to it, right? When we're patient care, you get to show up, do your work, and then normally when you leave, your work stays at the clinic, right? Right. But when you're
Right.
doing non-clinical, especially like education or as a product rep, sometimes it's like your work comes home with you.
It sure does. It sure does. And let's talk about entrepreneurial life too, right?
Oh boy. Yeah.
That's, stepping outside of at least I can speak for myself, my comfort zone, and you're a one-man show and that takes on a whole other level of working outside of clinical hours.
Right. And I think that is something, well, I'm a big fan of dental hygiene education, that and dentistry, dental education, and dental assisting education. That is one of the aspects where I wish there were more time to have a little bit more conversation about, now that you have your education behind your dental assisting, dental hygiene, dental degree, should you decide that doing direct patient care is not something that you want to stay in forever, because that's so focused on that. Like, what else can you do, and what does that look like, and how do you manage that? Like, there isn't a lot of education behind that. So you have to, it's like, you are definitely stretching your comfort zone and having to find your own resources, find individuals who have already blazed that trail ahead to understand, how do you manage all of that newness of it all.
Yes. When you figure that out, let me know, would you?
Well, I think that's one of the things, like, one of the reasons why we created this conversation between the two of us is that, one, we know what it's like to be out alone and trying to figure it out. So it's like, how can we be a resource to others, whether or not they're in the clinical field? And, maybe we should have more conversations about the different roles of a dental professional outside of direct patient care. Maybe this is a starting point for that conversation, because you do have to have a network of individuals. Just like with school, it is created for you, right? You pay your tuition, you have your people, your peers that you're learning with, and you have your guides, your teachers that are helping you go through that. So you pay your tuition for that. But I a true believer, then you have to then find your school, your group of people to help you go through that process.
Yeah, absolutely. Because there is so much that, you go to school and you learn how to be a hygienist, but there are other areas that you can venture into. And as you touched on before, product rep, or, I was there as our new students were coming in for the semester, and our Hugh Freedy rep was there, who was also a hygienist. So there's a lot of different paths that you can take. I think networking is a huge component. I think, if you are ever interested in product rep or product sales, get yourself out on a trade show floor, interact with those reps, find out, what did they do to get to that position that they're in now, and what steps or what advice do they have for you to get to there, or to get to that next level.
Yeah, be curious, ask questions.
Exactly.
Be curious, ask questions. And I would even say getting together with your local community of professionals, whether it is an association meeting, a study club meeting, just getting together with some of those individuals and and stepping up into different roles within that. Maybe you will take on a secretarial position or treasury position or some sort of chair of a continuing education,
Yes.
or community volunteerism, something along those lines, because that will help develop a lot of the skill sets that you need to not only within the operatory, like if you want to be a little bit more of a leader within that, but it will help stretch those skills for some of those other non-clinical opportunities that exist.
Yes, absolutely. I couldn't agree more with that.
Yeah. And that's really how I got my start. I shouldn't say my start, the opportunity to stretch into my non-clinical life was because of the volunteer work that I did within my professional association here in Oregon with the Oregon Dental Hygienists Association. Mm-hmm. I was doing work with them. People got to know who I was. They understood my work ethic. They could see my skill set beyond direct patient care, and then said, hey, there's this opportunity. I asked questions, was curious, and they're like, oh, well, here's some opportunities that you could have that are available.
And let's stretch on that a little bit, your skill set beyond clinical care, because we do, we have, as dental hygienists, we wear a lot of different hats, and we all have a lot of different skill sets that can be utilized in so many different areas. Mm-hmm. You sometimes just have to be comfortable with being uncomfortable to take that next step.
Right. Absolutely. And looking within your clinical life, if you're thinking you want to get out of direct patient care on a regular basis, like look to see what are some other roles within the office community that you work with that you could take on some of that. Because, I know hygienists, I know hygienists as well that have all of us, they went from being a clinician to being like maybe a lead hygienist, and then they started taking on some administrative duties, and now are some of the most knowledgeable administrative hygienists that I know, like vice presidents of or presidents of these larger dental organizations. So, it is that you don't absolutely have to have I am this, then this. You can have this transitional time and grow into that non-clinical life.
Absolutely. Especially with management opportunities, or, if somebody approaches you and says, I think you'll be a great fit for that, give it a try. Even if it's something you never thought of, try it and see, and see if you like it.
Absolutely. And when you do apply to some of those other opportunities, be very specific and looking at different ways that you have gained communication skills. Yes. Be very specific on ways that you have demonstrated your organizational capacity. Because with a lot of those non-clinical positions, doesn't matter if it's education, if it's corporate, if it is managerial, if it's research, if you become a key opinion leader for a product or something like that, you have to be strong in your communication and your organizational skills. Absolutely.
Absolutely.
Yeah. Or if you decide you want to run your own business.
Right. Oh, exactly. Exactly. I have like to-do lists everywhere. Everywhere I look, there's a different to-do list.
Oh my gosh. Yeah. And be prepared that you're going to take it home.
I know. Exactly. What would be your takeaway from this topic, would you say?
That, well, one, I would say it is not all or nothing. It isn't, you either are clinical or you're non-clinical. You can have both. You can definitely have both and be successful at that. You can still do direct patient care, maybe more on a part-time basis, and also do non-clinical aspect. But I would say my biggest takeaway or my biggest piece of advice is if you want to go into a non-clinical world, really ask questions and explore what is out there so you have an idea of a direction that you want to go. What about for you, Kim?
Same. I couldn't agree more. I am very happy that even with such a specific degree focus, it has opened up so many doors for me. And I would say, don't be afraid to open those doors. If I was to give a little bit of advice too, step outside of your comfort zone, because there's so much opportunity awaits out there. No matter even how big the dental world is, it's still very small. And a lot of people have a lot of knowledge to give.
Absolutely. Oh boy. And maybe sometimes they have knowledge that they want to give, but you aren't ready to hear. So you might have to be able to, like, wait, am I ready for that? So
Exactly.
be open, be open
Exactly.
to it. All
Yeah.
right. Well, and Kim, I think that I can speak for both of us that for anybody listening to this, if you have questions, further questions about going clinical life, but especially going into a non-clinical lifestyle, and you have anything more that you want to know about it, just reach out to us and ask those questions. You can find us on our social medias, and there's links to our websites within this podcast as well. So, right, Kim, I think I'm okay with saying that.
Yes, absolutely. Absolutely. And like I said, there's so many knowledgeable people in the dental field. So feel free to, reach out to either of us. We would be more than happy to share what we know.
Wonderful. All right, friends. Until next time, Tina and Kim saying goodbye.
See you later.
Thank you to our sponsor, Dental Post, the nation's largest dental job board. Be sure to check them out for different types of employment resources. Also, don't forget to like and subscribe to this podcast. And make sure you follow Tina and Kim on all the different social medias to learn other tips and tricks related to dentistry. Until next time, have a great day.